This is the Fix Your Sciatica podcast.
All right, and we're back. Today we're going to be talking about a very interesting subject, which is called the gut-brain axis and how it's related to the pain that we feel, particularly from a sensitivity standpoint. There's been a lot of buzz about the gut-brain axis recently, and there's a lot of misinformation out there. There's a lot of information. So how can we rifle through the fluff? Are we doing the right things? Are we doing the wrong things? What can we do to help get a better understanding on what we put in our bodies, but then also what's happening in our gut influencing our pain? And so today's special guest is a good friend of mine. She is a great jujitsu training partner, a naturopathic doctor, and an acupuncturist. So today I have Dr. Jen Clemons. Jen, so good to see you.
Thanks, Ashley. I'm stoked to be here, and like you, so glad to share information that might help people.
Yeah, it's and we've been training together for the past couple months, and at some point in conversation, in addition to talking about our families, I learned that you were a naturopathic doctor, and I knew that I wanted to interview you about something, but then when I started to look a little bit more into the work that you do, I said, wow, you are the person to talk to when it comes to the gut-brain axis. But before we go into the gut-brain axis, let's talk about naturopathic naturopathy, what that journey is like, what that profession looks like, and how does that actually fit into the traditional healthcare system, if that makes sense.
Awesome. Yeah, I mean, I feel like it's really some of the original medicine. Treat the whole person, identify and treat the root cause. A person is more than their diagnosis. I grew up in a Western medicine family, so that was an interesting trajectory. My dad's a ER doc, pediatrician. He's still practicing at 77, and my mom's a public health nurse. So I grew up with lots of questions and got really interested in this old but returning, so sort of new perspective on medicine, that rather than suppressing symptoms, if we really help the whole person heal, not only can we resolve the issue they came in with, but there's often other greater benefits that they'll experience. They'll come back and they'll say, oh, by the way, my headaches are gone. And I won't know they had headaches because, or the sleep is better, or things that we missed in the intake, or we've had this ripple out effect. And I love this part of the medicine of really bringing people back into their bodies and demystifying it. I think that's another awesome part about naturopathic. A really good naturopathic doctor has had at least 4 years medical training, clinical boards. I have to maintain my continuing ed, so that's different from a naturopath. Also respectable profession, but different. So clinical training, supervision, and as we're practicing medicine, it's more than, like green allopathy. It's really that. I feel like the root of the word doctor, docere, a true naturopathic doctor is driven by teaching and wanting to teach you and wanting to collaborate with you. That's one of the things I really love about the medicine I practice is we're working together. I don't even wear a white coat. I can, but it's which I think is a really awesome and necessary shift in medicine right now.
Huge. And I really appreciate you sharing that there is a difference between, say, a naturopath and a naturopathic doctor, because I think people will bunch those two professions up, and recognizing the training that you had to go through and everything is huge. And I also very much appreciate you saying that it is a collaborative effort. I think one of the challenges, and one of the big things I've noticed in healthcare is that it's often kind of like it's a one-sided power dynamic where it's like you go in to have the problem fixed and then you leave. And I noticed for myself as I'm going to various different doctors' visits, and it might be because of my medical literacy and what I know about the medical system, but my experience is very different compared to the experiences that my patients are sharing with me. Just because I think, one, there's a big limitation on time, right? Like the provider you're working with is often short on time. They might not necessarily be able to build up not just a relationship, but then also the specific strategies or action steps that both of you agree upon. We'll say like Western medicine relationship is like you go and you have a problem, and then you as a patient can choose to do or not to do that, rather than going into, say, something more involved, like working with you, or even someone like me in physical therapy, where you're going in, you're coming up with a plan, and you're actually going through it together. So when you do have your follow-up, it says, okay, we both agreed upon X, Y, and Z. Did you follow through? If not, why? How can we problem solve that? So really, really great that you shed light on that. And then, so let's talk a little bit more about the microbiome. Microbiome has been such a big buzzword probably over the past 4 to 5 years. I know that for me, I've had multiple stool tests and I've been taking a whole bunch of probiotics and all this other supplemental things. I have a very, we'll call it like an armchair expert level of understanding of what the microbiome is. But in essence, give us a good explanation for the listeners out there who might have heard that word. Let's talk a little bit more about that.
I think it's a fascinating topic. Even when I was in school, that was probably 20 years ago, we had an understanding that the gut bugs were good, but there's still this very basic idea like bugs are bad, we don't want bacteria. And yet we're made of more bugs than our own cells, right? The number of bacteria in our gut exceeds the number of our cells in our body. We actually rely on our gut biome. So I think about it like an ecosystem, which helps when I'm talking to patients about it, that you want to create a good composting system. You want to have, you're feeding those bugs. We're cultivating healthy, good bugs that can then, a healthy microbiome will actually make vitamins, which is kind of cool. They'll make some of the B vitamins and vitamin K. Their gut is responsible for the production of a lot of the neurotransmitters. And I think that's one of the key passions I have. Is an unhappy gut is probably an unhappy person. And they go together, because an unhappy person, and that's a very broad phrase, of course, but might be making choices that aren't helping their gut. A gut that's off balance can incite more cravings, more reactivity, all these different things. We're going to talk today about how it can impact inflammation and more pain in the body. So it's actually, you could almost, they'll call the gut like the second brain. This interplay of all these organisms in there, it really is a whole universe that directly affects our health. And I love that people are getting more interested in it. Which probiotics can help reduce depression maybe, or which probiotics get depleted in different illnesses is kind of fascinating, because some of the bacteria, things that we get will change the biome. How can we shift that back?
Yeah, it's so fascinating. I remember learning in my training about the digestive system is that I think it would call it like an open loop system. Pretty much like from our mouth to our anus is just one specific track.
It's just a tube.
And it's a
The
tube,
outside,
and
inside.
it's so fascinating. And they call it the second brain because I know that what I've learned was that like if you take the digestive system, you can actually stimulate just from one electrical impulse at the highest level, say like the mouth, and it'll actually stimulate the rest of the digestive system without actually needing like the rest of the body to work, which is particularly interesting, especially when you have people who have like spinal cord injuries, right? They have spinal cord injuries, yet they still can eat and have bowel movements and have all these normal functions because of that. And transmitters. Let's talk about neurotransmitters itself. And I think this is going to be particularly helpful and interesting to help visualize the merging of acupuncture, traditional Chinese medicine, and qi with Western medicine, because up until recently they were viewed as two separate things. But what got me really into my love of acupuncture is recognizing that the qi flow that you describe in your area of medicine is what we as physical therapists would be considered neurotransmitters, electrical impulses. It's the same thing, but we just call it something different. Yeah. So tell us a little bit more about, I just totally lost track of what I was going to say.
Well, one cool part is like pain.
Yeah. Well, we'll talk about neurotransmitters first, and then we'll talk about pain and inflammation.
Yep. Well, okay, the pain part does lead into, so you're asking about how neurotransmitters impact pain, or how acupuncture, I don't know how acupuncture impacts neurotransmitters. I know that it does.
I meant like, for example, so like a very simple example would be like, okay, we eat something what ends up happening is that as we eat something, our body digests it, our body then secretes insulin. It's like, how does our body know that we need to secrete insulin in order for us to absorb it? So sorry, I'm going to backtrack. We might not even need to get into it, but yeah, neurotransmitters, qi is really huge. And we're going to talk a little bit more about how kind of acupuncture ties into it, but let's talk about inflammation and the gut brain axis. So let's talk specifically first. Not about like inflammation in the gut, but inflammation in pain itself. So from your perspective, when the patients that you see who do have pain, we were just talking before that you did have some patients who did have some intractable pain, there's probably some sort of inflammation. From your area or point of view, how does often like systemic inflammation or inflammation that we encounter on a daily basis for long periods of time, how does that lead to like an elevated pain sensitivity or those chronic pain states that we can sometimes experience?
One of the first ones I'll talk with patients about is a natural reaction of the body to tighten down when there's pain, and people might even hold their breath a little bit or brace. And then when they do that, it reduces the blood flow oxygenation to the area. So often a lot of therapies you and I probably both do is trying to bring more blood flow or more chi to the area to clear out the lactic acid in the waste, to bring in clean, fresh blood, especially oxygen. So when I'm working with people working on a pain issue, acupuncture to bring chi flow there, having them breathe into the area. Also wires, what wires together, fires together. When we're in pain, the body almost gets wired to look for more pain, or the prostaglandins will shift that way. It does uses up some of the neurotransmitters. So that's that depletion that can happen. I would have to say probably dopamine and serotonin specifically, right? When we're running the adrenaline and the epinephrine, it burns out the happier, calmer hormones or chemicals, rather, neurotransmitters. And so that's where I'm losing my track a little bit. That's where pain can make us more grouchy. People can end up feeling more depressed. I know whenever I have a chronic pain or an issue or an injury from jujitsu, which I love to self-treat, that's how I learn more about it. But really, how are people moving through the day not incredibly grouchy? It takes so much of your time, energy, and attention when you're trying to guard or protect an injured area. And then there's the whole fascial connection and the body connection. So even though it's one part of the body over here hurting, the brain is aware of it. There's like a constant sort of a monitoring and a heightened alert system happening. Jiu-jitsu specifically, if I'm injured in one area, I have to gauge, is it okay to practice today, or am I going to be more likely to injure myself again because I'm already engaged in guarding and protecting this other area? My body's already wired to be more tense. There's a little less protection versus when you're feeling good and things are going well, you're a little more rubbery and bouncy and resilient.
100%. And what's interesting is that you were talking about like being on guard. And so, yeah, one of the things that we'll often do when we are in pain is we have a tendency to contract. And as you were saying, when you contract, you deprive your muscles of oxygen. But the reality is the fact that every structure, everything is a living thing, minus say like plastic, right? And so the thing is the fact that there's in our bodies, even when we're asleep, like no matter what, and even unfortunately, like even when we're dead, our bodies are still going through this like cellular metabolism, and our cells, because we're animals, require oxygen. And so when we deprive our different areas of oxygen because we constrict those blood vessels, we go through like these metabolic pathways that actually results in developing like those metabolites, like that lactic acid, that like the overproduction of hydrogen ions, which will create a lot of this heightened sense of pain. And I also really appreciate, Jen, that you tied in our emotional state and how it can influence our pain, but then how our pain can also influence our emotional state. One of the biggest things that I'll often do when I'm working with new patients is go through a little bit of it's a 2-question depression screen. It's really trying to find, is there something that could be an additional contributing factor to the pain that they're experiencing? Which I find to be particularly useful, because if I do say that a patient says yes, it would behoove me to bring that up, because if not, it would really provide a disservice for these folks. Let's talk about nerve pain specifically and let's talk about let's take a step back, because we know that pain is often related to inflammation and can also kind of promote more inflammation as well. But let's talk a little bit more about how like the gut-brain axis like really can influence the inflammation in our bodies, because I think that's the ultimate question of how does this all tie in, right? And so when a patient comes into you and they're experiencing a lot of chronic pain, and let's just for this episode specifically talk about like back pain or even nerve pain, what are some of the red flags, the things that shine out to you that says, let's look at the gut-brain axis? Is it something where you always look at the gut-brain axis with every patient that comes in to see you, or a patient comes in to see you, they have a specific problem, and then they present with certain things, which makes you ask some other questions?
I'm often going to ask about the gut anyway, just because it's such a foundation to health. I'm going to ask about gut, sleep, appetite, mood. When someone is coming in with chronic pain, especially a nagging something. They have that area, that flag that's always going, especially low back. I'm definitely going to ask about the gut first. It's in the area of it. And so I'd give you this in class example. It's kind of a gross example, but if we're reabsorbing water from the large intestine and that water is not clean or the large intestine is inflamed, it makes sense to me that the local muscles are going to then get more inflamed, right? Because it's carrying over whatever else was absorbed that was waste that should have left the body. I've also had great success, and I have a bias. I always tell people I have a bias about gluten because I don't do well with gluten. Some people do, but it is definitely one that I ask about when people are having chronic or nagging pain, especially if it's pain like at night and they're waking up with it versus an obvious injury, if it's just sort of this low grade bothersome thing, because gluten specifically can inflame and irritate the gut, and it can affect the thyroid. It can affect all sorts of aspects of metabolism. And so that slows down the house cleaning. And an inflamed gut, like I said, is going to just secrete across when we absorb the water, but it's also sending out signals that there is a fire or an alarm. So especially, for instance, talking about kids having trouble sitting still in class, I'll say to their parents, but it's us too as adults, if there's an alarm going off in here, it's not always specific where. So there's just a generalized alarm happening in the body, and it'll show up as a restlessness and irritability. Often they may or may not realize that they're constipated or have diarrhea. That'll be questions I'll ask about. And that can really tell us a lot of information. And then if I can tie it to what and when they're eating, the constipation one, I think, is really a big one. If things are moving slowly through the body, that's a slower metabolism. They're not getting the nutrition that they maybe are needing. And it just makes sense to me. And I've seen it improve when we address that the inflammation comes back down, the muscles are happier, the body's moving easier. Especially you and I both are encouraging people to move and exercise more. If we can bring the inflammation down by cleaning up the gut, their recovery time is better. And then they're more stoked to go and work out more and do exercise. So it's the gluten, whether it's the glyphosate that's sprayed on the gluten, can just cause this generalized alarm in the body, most likely from inflaming and disrupting that gut lining. And then the result is the chemicals that go around in the body saying we have a problem.
Yeah, and piggybacking off of that, as you were describing like what's happening, I do remember looking at the anatomy books and just knowing that like our internal organs, like our viscera, are actually, not only do they have their own kind of neurochemical pathway just amongst the blood vessels, but they also have their spinal innervation as well, right? So if we're looking at like the digestive tract, this is what Google has shown, but pretty much the foregut from esophagus to duodenum receives sympathetic input from thoracic spine level 5 and thoracic spine level 9. And then we go to the midgut, which is going to be from T10 to T12, and then the hindgut, which is going to be really more so like the transverse colon into the anus. We're looking at really more so like from our lumbar nerves and also even down to our sacral nerves as well, because that will also kind of control our sphincter muscles as well. And that's just the gut. And so if you have an inflammation at that specific like visceral level, it can actually radiate. And that's what we can often call referred pain. And referred pain is the pain that you're experiencing in that specific area. But what we're experiencing might not be the actual source of the pain. So let's talk about some of these like things that point to, all right, possibly some like gut health issues. So I know for me as a physical therapist, when I'm seeing a patient and their pain presentation isn't really making sense, and mostly I find this in patients who are experiencing primarily back pain, but in back pain with maybe some, we'll call it the ridiculous symptom of that sciatic pain. So like an example, someone who has intractable low back pain and they're like, there's no movement or position that makes it comfortable, but
especially left-sided, right?
yeah,
Because that's the
left-sided, yeah. But I experience relief when I avoid my bladder. And it's like, that's a very interesting thing. Could it be like there's pressure on the bladder? No, maybe. But also, I'm bringing this up because I had a friend who was experiencing this, and I just said, hey, like, does like anyone in your family have a history of kidney stones? And so they were like, yeah, my dad has kidney stones all the time. And it was like, okay, well, maybe you should go get that checked out. I'm not there to diagnose, but they ended up going to urgent care. It turned out that they were passing a kidney stone, which is why their pain was so intense, right? And so
yeah, and that's like some of the worst pain I've heard.
It's unbelievable. Really, what is important for us as physical therapists, like when you're working with a physical therapist, listeners, it's like we should be asking you, in addition to the symptoms that you're experiencing, what else is like happening and going on? So those are the things. And also like another thing that I find to be particularly helpful on my end, because again, I'm only just like 1,000-foot level from gut brain axis, but I would often, someone would be like, well, my pain isn't as bad when I don't eat X, Y, and Z. And it's like, okay, well, if it's related to food, well, that's really outside the scope of what I can provide. Would be a perfect opportunity to work with a naturopathic doctor like Jen. So when, any other things that kind of point out where you're like, ooh, like let's get that looked at first.
Well, I love that question you had too about if we can't relieve it positionally, or people will come in, they've taken the ibuprofen, they've done the pain meds, it's not touching it. Like that's a great flag to get a deeper workup and look at other potential underlying issues. Certainly the pelvic floor work can be remarkable. For myself, I had a great, it was a mouth issue, but as we're talking with this young patient, and he did okay with abdominal palpation, but I said, how bad does it smell when he poops? And the family was like, terrible. Like this little guy is blowing up the bathroom. That to me is a signal that there is dysbiosis in his gut. Something is not fermenting well. Something's causing inflammation. And I actually said to them, so we took him off gluten because that's just one of the starting places, gluten, dairy, and we can do more nuance, but those are the common triggers. And I actually knew there was a family history for him of gluten. And I said to the parents, when we get his gut happier, he's going to start paying better attention in school. And it's been happening. So that was for me a great example. And what we're looking for is for his poops not to smell so bad. It's such a telling thing. So the fermenting process, another example I have that's hilarious is this patient who wouldn't answer, how are your bowel movements? How are your bowel movements? He's a machinist. Finally, he said, oh, you want to know how the engine's combusting? I was like, totally. So that will lead me to the gut as well. Like you said, either noticing their stomach hurts from certain foods, low appetite or not being hungry or being very particular about foods will lead me to question inflammation in the gut. And the tricky one is we often crave foods that are terrible for us. So that was another example I gave, is at a very low point in my life.
This episode is brought to you by the Patient Advocate Program. Are you tired of not having support between your rehab sessions? Introducing the Patient Advocate Program, and we're focused on your recovery, and we're offering you 24/7 access to a doctorate of physical therapy. Stop waiting in line to be seen and stop spending hours doing long exercise programs. Imagine being able to get all of your care delivered straight to your phone. Best of all, it's affordable. We believe everyone deserves top-notch relief without breaking the bank. So why wait? Take control of your health today and visit ptpatientadvocate.com and book your free call with our experts.
I was basically eating quesadillas and that was it. And it was a comfort food because those also do trigger neurotransmitters and they give you comfort and they give you happy. That's why they can be addictive. It was also the worst possible thing for me because it was a gluten dairy combination. And I was low. So it was feeding itself. So when people don't want to give a food up, the smell of the bowels, if they're not going regularly enough. And then like you were saying, if it's a chronic left-sided low back pain, I'm definitely curious about sigmoid colon. That's the last exit before it leaves. I do love to do an abdominal exam, and we always start with looking and listening first. We don't just go poking in. But there's a lot to be learned, and I'll teach people too. This is where your stomach is. This is small intestine. As we get a little bit closer in about where the pain is, pain in the small intestine to me is different information than pain in the large intestine. And if it's painful over in the bottom right corner, as we're going like ileocecal, we might talk about things that can irritate that, nuts, seeds, pokey things. If it's on the lower left side, are they pooping regularly? I mean, I'll literally say sometimes to people, oh, here's your poop, right? Like you didn't go yet today. I'll teach moms or dads to do that up on the right and across on the left and down. People can do it. And I love that too. It brings it back to that gut brain. When we slow down and rub our bellies, it's calming, it's grounding, it brings us back in. We can breathe into there. And that alone can make a huge difference for people in their pain level. So these are all these places where we see that interplay and it can kind of highlight it. And some really simple things that you can bring on board for yourself, for your kids, that can have huge changes. Big benefit.
Yeah. And thank you so much for sharing that. And it got me thinking, especially when you are doing an abdominal exam. I don't do too many abdominal exams just because I wasn't trained in it, but I know that the abdomen does have a huge role. Usually the abdominal exam that I assess is I want to take a look if there's any sort of pouching or bloating. Really, for me, from my biomechanical standpoint, I'm looking specifically for any hernias, because hernias will identify any sort of pressure changes, which are often a biomechanical aspect of things, especially on my end. But I know that especially like it's not very often. And listeners, I want you to start thinking, like, when was the last time someone actually like touched your abdomen? It's a very sensitive area. Like, we're looking at the way society portrays everyone should be having six-pack abs, or we should suck in our stomachs or grip. So say, for example, if you don't have a set of six-pack abs, like, we are a little cautious about our midline or midsection, because it is a very, very sensitive thing. And so I'm so glad that you are assessing that, because it's really not happening very often. So we have the subjective data that you're getting from your patients' reports. You're getting your objective data based on sounds and palpations. Are there any other tests that you actually, like, either you do it in clinic or you have them do it outside to give you better data of what's going on in the gut?
I do think stool tests can be interesting, and there's just so many different tests out there. I just found out in a different CEU class I took that my favorite one was maybe not as good as I wanted, so I'm going to review. But these different tests can look at the stool sample. They can tell us, first of all, so the test I use, the first page is like the pathogenic and the really bad ones. And that's what I tell patients. If there was anything on this front page, probably you'd have more obvious, overt symptoms, excruciating pain, blood in the stool, different things. But once we rule those out, then we can look and see if they have H. pylori, which would usually be an abdominal pain, but could be a generalized system pain. When we go through the good bacteria, and that was, again, one of these switches I had in school, and then I'm looking at these tests to really think about good bugs. There's good bugs we want to see in there. We want them to be in balance. And there's some that are opportunistic, but not necessarily bad. And then there's the ones that could be more, so page 3 or so on this test shows us potential autoimmune pro-inflammatory bugs. So I'm looking there to see if those bugs are out of balance or in excess, and that can really help me target where to help a patient. We're still going to do the dietary changes, but we might use usually botanicals, address the bugs that are out of balance that could be aggravating the inflammatory picture. And then that could see a shift for them. There's also a little bit later on that test, and there's some great, like zonulin is an inflammatory marker when the gut is inflamed or leaky. So inflammation causes different chemicals to come. It can cause some gapping or inflammation in the gut, and zonulin is one of those markers. So if I see a high zonulin, I know there's inflammation in the gut. That's something we can work to address, test again to see if it's better. So they'll usually tell me that it's better, which is good. We're looking for symptoms as well as that, subjective. People like to see it on paper sometimes. But when we can see that things are improved. Well, let me back up. It gives us a starting place if there's an obvious dysbiosis or something out of balance. It can help us be strategic, like a recent patient. We're going to clear out the inflammatory bugs, reduce the inflammation, which is kind of acidic. Then we can introduce the good bugs back in. Because if we try to introduce the good bugs, especially like Akkermansia is kind of a sweet sensitive one, and there's an inflammatory issue happening, it might be a waste of a supplement. It might not really get to drop in and implant. There's so much we can do with the prebiotics and helping and supporting the gut. And so sometimes it's that, just really helping change the milieu and give it a better setting. Your gut biome can change in like 3 days, which is amazing. So when people do a fast or a cleanse, you can actually make some pretty quick changes. It's a matter of maintaining those changes. But I love inviting people to think about, like I said, it's compost. What am I feeding my bugs in there? Am I giving them food that they want to use, which is going to be less processed and more whole food, more good fiber and quality things? A different case, abdominal pain, so it's pretty straightforward, but I'm talking to this teenager about the spicy Takis. I mean, like obvious, right? But definitely causing gut pain, body pain, trouble focusing. Taco Bell, I've had it twice in my life, and both times I got explosive, awful diarrhea and never will go again. That's affecting the gut. That's affecting everything. It's so critical. The food allergy testing, I think, can be informative. I still see it as a snapshot or a sensitivity, because if someone has a really inflamed gut and they're eating all these foods daily, they might show an immune response or antibodies. It doesn't necessarily mean they can never have it again. So there's there's different schools of thought about that. And I want to work with patients to give them the information they need. Another patient, he had a food IgG response to coffee, which I was not expecting to see. And this guy loves coffee, like previous speed addict, and like now he's on the coffee. So he was having an immune reaction to the coffee and caffeine itself, raising his cortisol. It was like this triple whammy. And to show him on paper, yes, your body's making an immune reaction to this, was about the only thing that was going to actually persuade him to even consider it. And I bet he still hasn't given up coffee. I don't want people to have this huge laundry list of food they can't eat. That's my concern, is it starts to really, it can escalate. And at the root of all that is that gut inflammation. Can we address and clear out the bugs? Can we give nutrients or supplements to calm the gut? Can we get them to slow down and breathe and rub their bellies or do art or hum or sing? I mean, there's so many things that, like you talked about, the different nerve levels, calming the vagus nerve can help the gut. And that might be more valuable and more informative than any test, because you'll see the results right away. And then it's something tangible that they can do. So there are tests, and I love tests. I think they're really fun. They can be really interesting, and the data is very cool. I love a good negative test where we've ruled something out. What are we going to do with it? How are we going to use the information? And could I save you money by not doing the testing and just give you the standard foods to eliminate? And that's a test you can do at home. You can eliminate the foods and then challenge with them. And that is often very informative. I had another patient, we were working on his neck and shoulder pain, took him off gluten because of a thyroid issue. He didn't really notice much, but accidentally had gluten at a potluck. And then that night, and for like at least a week, could not sleep because all that shoulder and back pain came back. That was super compelling. Can I explain how the gut affected his shoulders? Not directly, but I could infer that inflammatory state, the muscles tightening. It was undeniable, that connection. And so that is even more compelling than a test result.
And what's really important, listeners, is using the test to get data and then making a decision on that, but then also reassessing the impact of said change. And this goes into thinking about when you're going to see, and I'm just speaking on behalf of physical therapists, but if you go into a physical therapy clinic and you're saying I'm having back pain or sciatica pain, and they do what I call like the base minimum physical exam, which is press on your back gently, kind of figure out what doesn't feel great. Have you bend forward, bend backwards, twist side to side, and bend side to side. And then from that information, give you exercise, stretch, exercise, stretch, exercise, stretch, without ever asking you, how was your pain compared to when you first walked in between each exercise. They're not testing and assessing. They're just getting the information that they just need for insurances, being like, hey, the range of motion is X, Y, and Z, but then giving you an exercise plan that they give every single patient that has sciatica pain. Really what should be important, especially when you are dealing with an active set of pain, is to be able to give the information. And that exam, I do that exam as well. But from there, doing a stretch or an exercise or a technique, giving you a pause to say, how do you feel as a result of that? And then move on to a different thing versus just going back to back to back to back to back. Unless you're at a point where you're in recovery where you can tolerate a little bit more. But for the most part, when you're in active state of pain, it is important for us to be able to get information. And so listeners, just like what Dr. Jen was talking about, is she has her exam, she has her tests, and the tests help her make an informed decision. For us as physical therapists, every exercise and stretch is also a test in itself. So I have to
individualized care. I love that you're talking about individualizing it, because I think that's what's missing. And I think that's what's so important for people. Someone might be able to, do that forward test. Someone else might not.
Mm-hmm.
Noticing what they can do, noticing improvements and changes is also helps people stay engaged with it. But that real individualization of care, and then the nuance of it, I think, is where people really will get success.
100%. And so let's talk about some of these action steps. I think one, we're getting a very good visual into how the gut-brain axis can actually influence our health, particularly from the pain standpoint. And we know that it's kind of like a 3-step process to repairing that, where it's eradicate the bad, calm it down, and then repopulate the good. So let's talk about some actionable practices from like the things that we put in our bodies, right? Because obviously booking, we're going to talk about what it's like to like book appointments with you, but also for the folks who don't have access to you, it's like, what are the things that they can start doing today that will actually just set them up in a much better position? So let's talk about some three major like dietary principles or shifts that you are a big fan of that you find to be very impactful for folks who want to reduce their gut inflammation, which then translates on over into just feeling better.
So one of the first ones that bugs me because I'm a snacker is really making clear time gaps between meals can actually make a huge difference. So just allowing the body the time to digest can make a huge difference in also giving it time to repair and heal. And because digestion actually takes a lot of time and energy. And we think about, for instance, detoxing from chemicals or the environment, but there's a redox process happening in our body. So allowing clarity between meals of time. So I'm not eating dinner by ideally 7 or so, and having that overnight time to clean house, that can actually really help reduce inflammation. Chewing your food well. I cured my college roommate's constipation with that. I don't think she'd mind me sharing that story, but she grew up on a farm with an older brother. And if she didn't eat fast, she did not get seconds. So she would eat really fast without chewing. But if we really slow down and chew our food, and like you said at the beginning of this too, it signals the rest of the body about the composition of the meal. So then the pancreas knows what to secrete. It gets the rest of the digestive juices and things going. So that's another. Chewing the food well, smelling your food. You don't want to just grab it cold out of the fridge. It's ideally, in my perfect world, you've actually cooked it or heated it up. That smell of cooking garlic and onions and you start salivating, that is a great whole process for digestion. First thing in the morning, you can have a glass of warm water or the warm water with lemon, and that will also signal the body food is coming. So that's one of those interesting ones where the ice water at the restaurant actually might be numbing your gut. So you eat more or putting out the digestive fire so you don't digest as well. But if you watch animals, and this is one of those key reminders we have in naturopathic school, when you're eating, you're eating. You're not eating and drinking. You don't want to dilute the digestive fluid. So just those chewing your food, slowing down and enjoying the food, maybe not watching the screen or being distracted, and having those clear breaks between meals. Another easy one is walking after meals. Gentle walking, right, can really help the blood flow, the digestion, the blood sugar balance. So those are things that don't necessarily have to cost anything. Now, the more bothersome ones are an anti-inflammatory diet and giving it a try. And usually people have to be pretty uncomfortable or in pain to really want to try it. It's so informative to do hard things, to challenge ourselves, right? And so you can do it for Lent. You can do it for spring or fall as a cleanse. I'm not so into the water fasting, but you can give up gluten, dairy, alcohol, sugar, and see how you feel. And often people will notice there's less inflammation around the middle. This can be a quick way to, trim up for an event if you want. It's certainly going to help your game and help you be better on the mats because you're going to be less inflamed. So you're going to recover better. And then, like I said, then after, ideally, it's at least a couple of weeks. That one patient, it was a couple of months. You can challenge with the foods and it'll be pretty clear. I have had people come back and say, I don't think the dairy is really affecting me. And I'm like, I can hear the dairy affecting you. So and it doesn't mean you can never have dairy. For myself, it'll give me a headache if I have too much. My mom saw me throw away half an ice cream once and she said, "You threw it away?" And I said, I could eat as much as I could. It's worth the $2 I threw away to not have the headache, right? So when we can really feel it in our bodies, then we can really make that more informed and honest choice for ourselves and save ourselves some pain later. So these are things you can experiment on your own. I'm always happy to help, but there's lots of great resources online. There's anti-inflammatory cookbook. There's all sorts of different things that you can find. There's great gluten-free cooking recipes now. When I first stopped eating gluten, it was terrible. It was like styrofoam bread. Oh, and quick caveat, just because you give up gluten does not mean you go buy all the gluten-free crackers, donuts, cakes. Really want you eating real whole food, protein, vegetables, good fats, and clean water. And that will save you a lot of money and time and suffering, really. It'll make Ashley's job easier. It'll make my job easier. So those are some really not always easy but straightforward things that you can do that can make a huge difference in so many aspects of your health.
1000% agree. I really love that you brought up the concept of like really analyzing and reassessing how it makes you feel. I know that that was something that if I look back on my journey with food when I was a kid, obviously when you're a kid, you're just like, you're eating because it's part of like family time. And then I really had to go into kind of like an independent phase when I was in college because it was like I was an athlete. I needed to eat to fuel. But here you are at a college cafeteria and there's all this food. Did I sleep during the like what food is good for you sections of being an athlete? 100%. I ate everything. And then it wasn't until I retired from collegiate swimming that I had to really say, like, how do I eat? And it wasn't until I'm 37 right now. It wasn't until I was like 34, like 33, 34, where I realized, oh, this is how, like, these are the patterns on how I eat. But then also, if I take a moment and reflect on like how do I feel after eating specific foods, those reflecting on that is what drove me to the foods that I'm eating now and drove me away from the foods that I'm not eating anymore, right? And so as you said, like, eating Taco Bell, I remember loving Taco Bell as a kid, but now you're 100% right. Like, had some Taco Bell, explosive diarrhea, it didn't work for me, right? So being able to just recognize that and then asking yourself, is it worth eating that food for maybe the very, very temporary moment of pleasure to have all that pain, right? And that's definitely something that,
Sometimes it is.
yeah, sometimes it
I
is.
mean, go
Sometimes it
for it.
is. Yeah,
Yeah.
go for it. And then sometimes it's like, it's not worth it, right? And so that's just a conversation that I definitely recommend. And as Jen said, that there are many different resources that are out there. We are running a little bit long time, but I do want to ask from a supplement standpoint, not from like a supplement recommendation, but some of the things that you see or that you're a fan of for the folks who are trying to like rebuild their gut. What are some of the things, like we'll say top 3 supplements that you find to be particularly useful?
For the gut. Okay, first reminder is quality, right? So we don't want to buy probiotics on Amazon. We don't know if those have been kept at a cool temperature or, you know, if there's even in the bottle what we think it is. So making sure you have a reputable source. Now you can get great probiotics from sauerkraut, fermented food. I was just having a conversation the other day with a patient who had let her sweet potatoes get cold. I knew this about white potatoes, but I had to look it up. Sweet potatoes also, and other healthy complex starches, when you let them get cold, and you can heat them up again, but they become a resistant starch. Something changes in the sugar molecules, and that becomes a prebiotic. So this is why potato salad, as long as it hasn't sat out all day, is awesome. So thinking about prebiotics, I have some burdock in my fridge. I cut it up in thin strips and I kind of toast it. It's called burdock fries. I learned that from an herbalist, Brigitte Mars. We love it. These are foods that feed the gut bugs, and that's going to help make your gut bugs happier, and that's going to make you happier. So that's even just what you can do in your own and in the store, quick things you can grab. I do love a good probiotic. I used to really be stuck on them daily for everybody. And now I'm starting to feel like specifically, so maybe following antibiotics, or if there's been another issue, or certainly following a gut bug or a diarrhea, or if I've seen on the test, that one patient, it was absent, the Akkermansia, and that does have a GLP potentially benefit. I do want to help support her levels of it. I think magnesium is really one of the most amazing. So if you get a citrate malate, that might make the bowels move too much, but that also helps relax the muscles. There's magnesium for the brain. There's balances of magnesium. I think if someone was just starting with any supplement, I think that could really be a good one. So probiotics can be good, but be specific. The magnesium, pretty much ubiquitously good for everyone. And then when we're seeing a gut inflammation issue, there's different places I do like to start. I mean, I do love L-glutamine. And again, you want doctor supervision. This is pretty benign, pretty easy, but it would be good to know what you're doing and how much you're dosing and what you're looking for. Butyrate is another one I'm getting excited about. It's in butter. That's where the name comes from. And this is a great, it feeds the enterocytes, which is a really cool idea. So I love butter and I'll eat a lot of butter. My daughter laughs because when she was little, she basically would just pick the stick up and eat it. And I'm still totally fine with that. But to get butyrate in a supplement is going to give you a higher amount. And if you can feed those gut bugs, that can help calm things down and smooth them out. Now, If you're having butyrate and you're still having coffee and coffee's inflaming the gut, we'd have to have a conversation about that. There are people who put the butter in the coffee, right? So it depends on the person. But those are probably the top, the probiotics. And remember, you can get prebiotics from your food. Magnesium, pretty much good. Remember, there's different kinds. So you want to be specific. I don't know if you want to move your bowels or not, but that can be fantastic for keeping things pretty happy. And then butyrate is a recent favorite, or the L-glutamine. I guess I gave you more than 3, but those are some key ones to learn about and think about that can really quickly effect a change. And then when the patient comes back and their gut's feeling more calm, then they're more receptive to talking about these other changes and ideas. And we're going to go farther because, when someone's in pain, it's hard to really think about anything else. Get them feeling better, and then we can have them doing more stretches and more exercise. And then also I wanted to add, because what you said was absolutely true. When you're an athlete, you can eat almost whatever you want because you're going to burn it so fast. So I tell my patients that if you want to eat all the crap, go for it. But are you willing to do the caloric burn to offset that? And if you're not going to, then yeah, you're going to have to be more intentional about calories, quality.
Awesome. There you have it, listeners. Really helpful, actionable just tips on gut health, because we know that the world of gut health is expanding. There's a lot of information that is out there. Our goal for this episode was to really boil things down to give you a much better view of it, so you can all make informed decisions in regards to what's going to be best for you. Dr. Jen is a naturopathic doctor and acupuncturist, and she's brilliant, as well as an awesome jiu-jitsu partner. For the listeners out there who want to get in touch, possibly even work with you, what is the best way to get in touch?
The website's straightforward. So, www.drjenclemons.com. If you're in California, I would love to see you in California. You can come in person. You can get the acupuncture and the cranial therapy. We'll get your tummy rumbling. That's amazing. If you are not local, then we can do telemedicine in California. And then outside of California, I do offer wellness education, which is basically what I do with my patients anyway. So I can't prescribe or diagnose if you're outside of the state, but I can lead you to resources and information. And it just really fits with my whole goal, which is empowering patients. So you're in charge of your health, and I'm a resource for answering questions. I love to research, look stuff up, come up with other ideas, thinking outside of the box. And that's really fun. You can sign up for the newsletters on that website. So you get a weekly health tips. We just did one about benefits of meditation. I cited jujitsu because I don't really like to sit still to meditate, but jujitsu is very meditative because you cannot think about anything else, or you're going to get submitted or knocked over. And next is going to be talking about seasonal foods, which will obviously help the gut, eating in season and tuning into what's happening around you. It's such a good mental health practice.
Yeah. And us living up here in Northern California, we have the best seasonal vegetables, I think, in the country. And so it's pretty amazing. So listeners, if you did not get a chance to write that down, I'm going to go ahead and put that into the show notes. So reach out to Dr. Jen. She's brilliant and she's awesome. And Jen, thank you so much for taking the time out of your day to share with the audience your expertise.
Ashley, thank you so much for the opportunity. And then in a few, we'll come back and talk about the acupuncture part for sciatica. But yeah, 100. I hope this was helpful for even just one person out there. And there is help. And if it was interesting, please reach out. So much good information. Rad.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.